Hello everyone, this is Dr. Madhusudan Rao and the program I teach medical students. Today the topic of my lesson is iron toxicity. Iron preparations are commonly prescribed and they're also purchased across the counter. When the children consume accidentally the adult preparations of iron tablets, it is going to cause devastating complications in children leading to death. This is very important to understand the iron metabolism and the effect of iron on the tissues when consumed in excess. We are going to touch this particular aspect of iron toxicity in brief in today's lesson. Iron toxicity is one of the most common poisonings. It is serious and deadly in children. Unless diagnosed early and treated effectively, it may lead to serious consequences and death. You know, iron preparations are sold across the counter. The people they purchase the iron preparations across the counter and keep within the reach of the children, and children consumes the adult preparations which contain the higher content of iron may result in serious complications and death. So remember, if you keep the iron tablets within the reach of the children and children consume them accidentally, may result in serious complications and death. You may lose the child. The accidental ingestion of the adult preparations by the children is most common under age of 6 years. Well, repeated regular transfusions is also a cause of iron toxicity in children. Children, especially suffering from transfusion dependent hemolytic anemias like thalassemia and sickle cell disease, they may also suffer from iron overload and iron toxicity because by through each transfusion we are loading the body with an amount of 250 to 300 milligrams of iron. There is no exit of iron from the body, so it remains in the body causing the cellular damage, especially the liver and heart and also pancreas and some of the endocrine glands like pituitary gland. So the toxic effects of iron, they are described under the topic hemosiderosis. Iron poisoning in adults is a suicidal attempt. Here in this lesson we are talking about the acute overload of the iron in the body leading on to toxic effects. Etiology. Well, less than 20 milligrams per kg when consumed is non-toxic. If consumed 20 to 60 milligrams per kg, it may result in moderate symptoms. Serious complications and manifestations do occur if consumed more than 60 milligrams per kg body weight. This amounts to nearly 10 times the therapeutic dose of iron. We have to speak the iron consumed in terms of elemental iron. So it is very important to know the elemental iron content of the iron preparations. Say for example, ferrous sulfate, which is commonly prescribed, has got 20% of the iron as elemental iron. Ferrous gluconate 12% and it is 33% of elemental iron in ferrous fumarate. Then what is the pathophysiology? Iron toxicity can be described as two types with regard to pathophysiology. That is corrosive effect. Number two, cellular poisoning. Corrosive effect is on the mucous membranes, resulting in severe abdominal pain, nausea, vomiting, and diarrhea due to mucosal ulcerations. There will be fluid loss and blood loss resulting in shock. Necrosis of the intestinal wall resulting in perforation and complicating peritonitis. Well, if the child survives or the patient survives, healing results in intestinal obstruction as a late manifestation. Coming to the cellular effects of the iron, it is rapidly taken into the cell. When there is a, say, in the plasma, there is unbound iron, ferrous form. It does not require any channels. It can cross the cell membrane and damage the mitochondria. And there is metabolic disturbance resulting in uncoupling the oxidative phosphorylation, thereby resulting in the release of free radicals and tissue injury. This can occur in liver, the heart, or in the nerve cells. This is the picture showing the pathway of the iron absorption and its storage. Iron is absorbed from the gut. From the gut, 10% of the iron that is taken to the diet is absorbed and bound to the transferrin. Okay, from there reaches the liver and the other, organs like bone marrow, where the iron is utilized for erythropoiesis, for the hemoglobin synthesis. And iron is also released into the plasma as a lysis of the RBC. As a regular phenomenon, regularly there is lysis of the RBC, releasing hemoglobin into plasma. Globin part is utilized for the amino acid and enters the amino acid metabolism, and the iron part is taken by the macrophages and stored in liver. This is the common pathway of the iron in the circulation and stored as ferritin. When there is excess of the iron that is taken through transfusions, etc., the ferritin molecules, they unite together to form the hemosiderin. Okay, ferritin molecules are not seen through imaging. Hemosiderin is seen through imaging technique. Coming to the toxicokinetics. Iron absorption is complete 2 to 4 hours after ingestion. 10% of the iron is absorbed. Okay. Serum iron level is 50 to 150 micrograms per deciliter. Total iron binding capacity is 300 to 400 micrograms per deciliter. Iron is bound to transferrin in the circulation. Iron intoxication results in saturation of transferrin, and the unbound free plasma iron is toxic to the tissues, which I already told you. Coming to the clinical features. Clinical features of iron toxicity is explained in 5 stages. It's very important to understand the stages and the time of occurrence so as to help the clinician to identify the clinical features and correlate with the time of ingestion of the iron preparations. Half to 6 hours, first stage. Patient complains of abdominal symptoms like pain, nausea, vomiting, hematemesis, melena, and diarrhea, bloody diarrhea. It is first stage 1 seen within 6 hours after ingestion of the iron preparation. Between 6 to 12 hours, there is symptom-free phase, even though serum iron levels are high. So this is very dangerous. Serum iron levels are high, but the patient is asymptomatic. Between 6 to 72 hours, that is phase 3, there will be reappearance of GI symptoms. Patient suddenly goes into circulatory failure and shock. There will be metabolic acidosis because of anaerobic metabolism. There is coagulopathy due to injury to the liver and multi-organ failure. This is a very critical stage of iron intoxication. Next, stage 4, that is between 12 to 96 hours. There will be elevation of hepatic enzymes and progressive hepatic failure. So, over a period of 2 to 8 weeks after iron intoxication, features as a consequence of healing of intestinal lesions results in intestinal obstruction and pylori stenosis. How do you proceed to confirm the diagnosis and the lab evaluation? History is very important to suspect the iron toxicity, and the lab evaluation will tell you the degree of iron overload. Go about with the estimation of serum iron levels 4 to 6 hours after ingestion. Okay. If serum iron level is less than 350 micrograms per deciliter, it is mild toxicity. The toxicity is said to be moderate when the serum iron levels are between 350 to 500 micrograms per deciliter. And if the serum levels of iron is more than 500 micrograms per deciliter, it indicates severe intoxication. Also ask for serum electrolytes to understand the degree of dehydration and the renal toxicity. Go with the liver functional test like enzymes and ask for renal functional tests and take the X-ray abdomen. There, if some of the iron preparations are there, radio opaque, you can see the opacities in the gut. It is not always that you see the radio opaque tablets, iron preparations in the X-ray of the abdomen. Now, proceed with the treatment. Gastric lavage. If the patient presents early, gastric lavage help you to remove the tablets retained in the gut. But take care that you are not going to injure the gastric mucosa, resulting in perforation. Okay. Whole bowel irrigation with polyethylene glycol can be done. Coagulopathy is treated by vitamin K administration and by fresh frozen plasma. Treat the shock and circulatory failure with IV fluids and blood transfusion. Chelating agents like deferoxamine is administered in order to reduce the iron overload. Counseling is so important so that children will be protected, okay, and the parents will take care not to keep the adult preparations or the iron preparations within the reach of the children. And the adults who have tried to commit the suicide, the counseling is very important. These are certain of the steps that are taken in the management of iron toxicity. Besides, follow-up is very important in order to look into the late consequences of iron toxicity, that is, intestinal obstruction, pyloric stenosis, etc. When do you plan for discharge? If the patient is asymptomatic for 4 to 6 hours following ingestion of, keep the patient under observation. Okay. The patients with serum iron levels more than 350 micrograms per deciliter should be admitted. And the patients with severe toxicity should be treated in intensive care unit under monitoring. The serum iron less than 350 micrograms and patient is asymptomatic, and keep the patient observed for 6 to 12 hours. Look for the hemodynamic stability, then plan for discharge. Okay. What are the criteria for discharge? He must be asymptomatic, observed for 6 to 12 hours, and serum iron is less than 350 micrograms per deciliter, and the patient is hemodynamically stable. Then plan for the discharge. A note on the complications: liver necrosis, cardiogenic shock, myocardial dysfunction, coma, seizures, intestinal perforation and peritonitis, and intestinal obstruction. These are some of the complications of iron toxicity. So let us look into some of the pictures. This is the iron deposited in the liver. This is the infant or this child consumed iron tablets. You see, the iron tablets are stuck in the intestinal mucosa. You see the corrosive effect of these iron tablets, iron causing ulceration with impending perforation. This is the normal pathway of the iron absorbed. Okay. Iron is absorbed from the gut. Iron is released from the senescent RBC, taken by the macrophages. Okay, excess iron is deposited and stored in the liver. This is the liver showing necrosis due to iron toxicity. Thank you very much for patience listening. We'll meet you again in the next class. Until that time, bye bye, and take care of your children. That do not take the iron tablets. Do not keep the iron tablets within the reach of the children. Avoid accidental consumption of iron tablets by your dear children, and don't let loved ones lost accidentally. If you like my video, please subscribe to my channel, and we'll meet you again in the next class. Until that time, bye bye.